Welcome to SSR Pharma Media, your trusted source for pharma knowledge. Today series HAP Exam H series MCQs for Success, Human Anatomy and Physiology. Today we are going to discuss about Cardiovascular System CVS Part 2. Prepare, practice, succeed. So we discuss about cardiac cycle and ECG, electrocardiogram. So important concept of this cardiac output is equal to heart rate into stroke volume. Stroke volume approximately 5 liter per minute. And factors affecting heart rate: autonomic inversion, hormones, fitness level, age. So these are all affecting the heart rate. And factors affecting stroke volume: heart size, fitness level, gender, contractility, duration of contraction, preload, afterload. So this all affecting the stroke volume. So stroke volume, and finally the cardiac output CO is equal to heart rate into stroke volume. So cardiac output per minute. So heart rate, it is containing nervous and hormones, and stroke volume, it's indicating blood volume and vascular resistance. So we'll move into the question. The cardiac cycle duration at the heart rate of 75 per minute is approximately, so option A 0.5 second, option B 0.8 second, option C 1.0 second, option D 1.2 seconds. So the answer is option B 0.8 seconds. So 0.8 second. So this is the cardiac durations. Cardiac cycle duration of the heart rate 75 per minute. So our heart rate is a 60 divided by 75. So is equal to 0.8 seconds. So next, cardiac output is calculated as option A stroke volume, heart rate divided by stroke volume. Option B heart rate into stroke volume. Option C EDV minus ESV divided by HR. It means cardiac rate, heart rate. So EDV into heart rate. So EDV means end diastolic volume. ESV means end systolic volume. So the answer is option B, heart rate into stroke volume. So cardiac output is equal to heart rate into stroke volume. The average 70 ml, that means 75 is a heart rate, and stroke volume is 70 ml. So approximately 5 liter per minute. So next, if heart rate is equal to 100 per minute, cardiac output equal to 5 liter per minute, what is the stroke volume? Option A 30 ml, option B 50 ml, option C 70 ml, option D 100 ml. So the answer is 50 ml per minute. So now we'll see the formula. Cardiac output is equal to heart rate into stroke volume. So heart rate they have given 100. Stroke volume they have given 5 liters. So heart rate and stroke volume 5 ml, 5 liter we have to write in the ml divided by 1000 ml is equal to 50 ml. So you have to substitute in this formula in order to find out the stroke volume. Stroke volume we don't know, We know the cardiac output and is equal to heart rate. So heart rate is 100, cardiac output is 5. That means 5,000 ml is equal to 5 liter. So we will get the stroke volume. Stroke volume is mainly determined by all of the following except option A, preload, option B, afterload, option C, myocardial contractility, option D, heart rate. So the answer is option D, heart rate. Stroke volume is influenced by preload. That means end diastolic volume. Afterload is arterial resistance and contractility. Heart rate modifies cardiac output but not SV directly, stroke volume directly. Which phase of the cardiac cycle is longest duration under resting condition? Option A, arterial systole. Option B, ventricular systole. Option C, ventricular diastole. Option D, isovolumetric contraction. So the answer is option C, ventricular diastole. So ventricular diastole is the longest duration of the cardiac cycle. So at rest, ventricular diastole lasts longer, 0.5 seconds compared to systole. 0.3 seconds is a systole. So this allows time for ventricular filling. Next, ejection fraction is best defined as stroke. Option A, stroke volume divided by end diastolic volume, EDV, EDV into 100. Option B, stroke volume divided by end systolic, ESV into 100. Option C, cardiac output divided by heart rate into 100. Option D, stroke volume divided by cardiac output into 100. So the answer is option A, stroke volume divided by end diastolic volume into 100. So stroke volume is equal to end diastolic volume into 100. So next, according to the Starling's law, an increases in end diastolic volume leads to option A, decrease in stroke volume, option B, increase in stroke volume, option C, no change in stroke volume, option D, increase in heart rate. So the answer is option B, increase in stroke volume. Frank Starling mechanism states that the greater filling preload stretches myocardial fibers, leading to strong contraction and higher stroke volume up to physiological limit. Which part of the cardiac cycle corresponds to plateau phase in ventricular action potential? Option A, isovolumetric contraction. Option B, ventricular ejection. Option C, isovolumetric relaxation. Option D, atrial systole. So the answer is option B, ventricular ejection. So plateau calcium influx maintains contraction during ejection phase. Next, preload of the heart is best represented by option A, end systolic volume, option B, end diastolic volume, option C, aortic pressure, option D, systemic vascular resistance. So the answer is option B, end diastolic volume. So preload, it is the type of degree of stretches of ventricular fibers at the end of the diastole, and it is represented by end diastole volume approximately 120 ml. It depends on venous returns. So it's a preload and afterload. Preload volume of blood in ventricle at end of the diastole. So after load, resistant left ventricles must overcome to circulate blood. So due to that, increase the hypertension and vascular contractions. So due to preload, so hypovolemia and cardiac valves and heart failures occur. Next, afterload is primarily determined by option A, venous return, option B, aortic pressure, option C, end diastolic volume, option D, myocardial contractility. So the answer is option B, aortic pressure. So afterload, it resistance against which the ventricle must pump blood. For the left ventricle, it corresponds mainly to aortic pressure. For the right ventricle, pulmonary arterial pressure may occur. Next, which vessel carries blood from right ventricle to lungs? Option A, aorta. Option B, pulmonary vein. Option C, pulmonary artery. Option D, coronary artery. So the answer is option C, pulmonary artery. So pulmonary arteries carries deoxygenated blood from right ventricle to lungs for oxygenation. So let's we discuss about ECG, electrocardiogram waves and their significance. So in ECG, so there are types of waves: P waves, RP interval, QRS complex formation, ST segment formation, T waves and QT interval. So P waves represent atrial depolarization. It's a normally duration more than 0.12 seconds. So when P waves occurs, the absence or abnormal in atrial arrhythmias. And RP interval, atrial depolarization plus AV nodal conductions happens, and its a normal duration 0.12 to 0.2 seconds. So prolonged in first degree heart block. And QRS complex formation, ventricular depolarization, so more than 0.12 seconds. So when ventricular depolarization happens, whites in bundle branch blocks and ventricular arrhythmias may happen. And ST segment plateau phase, so ventricles depolarization, depolarized ventricles may occur. So it's a normal isoelectric point. So it's in this phase elevated in myocardial infarction, depressed in ischemia. And T waves, ventricular repolarization. So P waves, atrial depolarization, T wave, ventricular repolarization. And QRS, ventricular depolarization. So it's atrial depolarization, here ventricular depolarization, here ventricular repolarization. So cycle is 0.16 seconds. So if this peak is tall, hyperkalemia may occur and inverted ischemia happens. QT interval, so it's represent ventricular depolarization and repolarization. So 0.35 to 0.44 seconds may occur duration. So prolonged this QT interval is the risk of Torsades D points. We'll move to the question. What does the ECG primarily record? Option A, mechanical contraction of the heart. Option B, blood flow through the heart chambers. Option C, electrical activity of the heart. Option D, heart sound during cardiac cycle. So the answer is option C, electrical activity of the heart. So ECG records the electrical potential generated during depolarization and repolarization of the cardiac muscle fibers. It does not directly measure mechanical activity or heart sound. So it's a P wave and QRS complex, then ST segment and T wave. The P wave in an ECG corresponds to option A, atrial depolarization, option B, atrial repolarization, option C, ventricular depolarization, option D, ventricular repolarization. So the answer is option A, atrial depolarization. So the P wave reflects depolarization. P wave reflects depolarization of the atria before atrial contraction. Atrial repolarization is not visible. Is a hidden in QRS complex. Hidden in this QRS complex. Next, QRS complex represent option A, atrial depolarization, option B, atrial repolarization, option C, ventricular depolarization, option D, ventricular repolarization. So the answer is option C, ventricular depolarization. So QRS complex correspond to ventricular depolarization. It is large due to the greater muscle mass of ventricles. Next, the T wave in a normal electrocardiogram ECG is due to option A, atrial depolarization, option B, ventricular depolarization, option C, atrial repolarization, option D, ventricular depolarization. So T wave. So the answer is option D. So ventricular repolarization. So it's a ventricular repolarization is indicating by T waves. The T waves represent repolarization of ventricles. So repolarization. Normally it is upright in most leads. Next, the PR interval normally represents the time for option A, atrial depolarization only, option B, ventricular depolarization only, option C, ventricular repolarization only, option D, conduction from atria to ventricles through AV node. So the answer is option D, conduction from atria to ventricles through AV node. So PR intervals nearly 0.12 to 0.2 seconds. It includes atrial depolarization and AV nodal conduction delay before ventricle depolarize. So if you like this video, please share and subscribe. Next, prolonged QT interval in electrocardiogram is clinically associated with option A, tachycardia, option B, risk of arrhythmias, torsates, depoints. Option C, atrial fibrillation. Option D, normal athletic heart. So the answer is option B, risk of arrhythmias. So QT interval represent ventricular depolarization and ventricular repolarization. So prolonged QT can predispose to life-threatening ventricular arrhythmias. It is torsates. Next, which part of ECG is most useful for detecting myocardial ischemia or infarction? Option A, P wave, option B, PR interval, option C, ST segment, option D, U waves. So the answer is option C, ST segment. So ST segment normally lies on the baseline. It's isoelectric. That means isoelectric. And elevation It acute myocardial. If ST segment elevation happens, it indicates acute myocardial infarction. Depression, suppose elevation, it is called acute myocardial infarction. So depression of ST waves, it's indicating myocardial ischemia or digitalis effect. Thus, it is the key indicators of coronary artery disease. Next, the second heart sound dub is caused by closure of option A, mitral and tricuspid valve. Option A, mitral and tricuspid valve. Option B, tricuspid and pulmonary valves. Option C, aortic and pulmonary valves. Option D, aortic and mitral valves. So the answer you tell in comment. So join in our WhatsApp community group and you will get hands-out material and test series. Thank you. Like, share, subscribe. Thank you.